Hi friends, I hope you are enjoying the Unplugged series on DAMS YouTube channel. Unplugged is an initiative by DAMS to create integrated educational videos where we are able to give you perspective on clinical scenarios, not just on MCQs, just how to approach a clinical scenario. These scenarios I feel are useful for all graduates as well as even for postgraduates, who keep following our channel to understand how to look at a case. Now today I'll show you a small case of a uh, interesting group of findings that you keep getting in your exam, especially if you're appearing for a pediatrics final year exam or a MD radiology also exam. It's very important. Now this is a 1.5-year-old child. He has an abdominal lump with a left parietal swelling. So whenever we are looking at this clinical history as a radiologist, you already know we are looking at a pediatric age group, a specific age group of 1.5-year age, and we are looking at somebody who has abdominal lump with a scalp swelling. Now when we look at this combination, now why would somebody have two diseases together? Either they are coexistent or maybe we are looking at the same disease process. Now if you're looking at the same disease process, why would you have two lumps? Now that is a marker of probably of spread. We can't say this on this much on a history alone, but you can see two lesions. One of them is an abdominal lump with a scalp with a parietal swelling. It says parietal swelling, parietal bone swelling. But like we already are thinking. Now when we are thinking, let's look at the CT scan of the patient. This is how a non-contrast CT of the abdomen looks like in this child. This is the liver of the child. You can see this is the kidney, and this is what the lump is looking like. And when you look at this lump, can you see there are areas of speckled calcification inside? Can you see those faint amorphous areas of calcification? And the mass is not restricted to the midline, it appears to cross the midline. But to evaluate it further, we need to do a contrast enhanced image. When you do the contrast enhanced image, you can see the mass. This is the kidney, and the mass appears separate from the kidney. It is actually more anteriorly located to the left kidney. It looks like a retroperitoneal mass with, you can see the necrotic areas which are non-enhancing. You can reconfirm the calcification, but I want you to look at the aorta. When you look at this area where you can see the great vessels, which I marked with the finger for you, you can see that area that the vessels appear encased by the mass. The aorta actually appears lifted up above the vertebra, and there is a tumor rim encasing the vessels. So if I may ask you now to summarize what you already know, that abdominal lump that we saw is a heterogeneous mass separate from the kidney in the retroperitoneum, appears to cross the midline, has vascular encasement, has speckled calcification. And you know by now from your clinical knowledge that we are already looking at possibilities of, in a child you think of things like Wilms tumor, neuroblastoma, but here we could see it is there is a plane separating the mass from the kidney, and you see some things which are unusual for Wilms. In Wilms, usually you would not have speckled calcification. Even if you have calcification in Wilms, it is more like a rim calcification. And Wilms tumor would not cause vascular encasement. It would actually push the vessels to the other side. You can see vascular encasement, speckled calcification separate from the kidney. We are thinking in terms of neuroblastoma. But what about that parietal swelling? Let's also look at his CT brain. When you look at the CT brain in this child, you can see this mass which has a broad base towards the skull, broad base towards the ostium, the bone, and we need to look at this on the bone window as well to understand, is it actually involving the bone. So when you see the bone window, you can see this bone appears eroded and the suture appears widened. Such sutural metastasis or osseous metastasis in the skull with sutural deposits is very, very typical of neuroblastoma. Now when I look at this, I also remind you that Wilms tumor on the other hand has classic tendency to show pulmonary metastasis. Here we can see the bony metastasis, the sutural metastasis in the bone. They're all going in favor of neuroblastoma, plus we already saw the imaging features. So what is our diagnosis? Our final diagnosis here is we are looking at a neuroblastoma with sutural metastasis. But as a resident, as a final year MBBS student, or anybody appearing for an exam, we need to know the differential diagnosis. But I also want you to see the way to describe it. So you would say there is a heterogeneously enhancing mass in the retroperitoneum in the suprarenal region crossing the midline with some foci of calcification, encases the vessels, and skull shows the sutural mass, and that what we discussed, the erosion of the parietal bone. The key questions are, what are the other DDs to consider? You remember the classic DD between the neuroblastoma and Wilms in a child. You could have the cystic nephromas, lymphoma, leukemia. They all remain the important DDs of abdominal lump in a child. The second is that why this is not Wilms. Okay, Wilms is going to arise from the kidney. We saw that in this patient. We could see a cleavage plane between the kidney and the tumor, and we remember Wilms would be at an age group which is slightly older. The calcification, even if it's there, it is less common, more rim calcification, while in this patient we saw the calcification was more speckled, and pulmonary metastasis a feature of Wilms. These are the key take-home messages for anybody who's looking at this lump in the exam. So this was what I wanted you to learn today, and the key take-homes here were the difference between the neuroblastoma and Wilms, and the presence of that sutural metastasis, osseous metastasis in neuroblastoma should be in your mind when you look at it. Do follow us on DAMS Daily channel on YouTube and DAMS Daily page on Facebook for more such important unplugged videos. And it is a very good idea to scroll through the YouTube channel and just see the previous unplugged we have done. We have done hundreds of unplugged videos so far where we have discussed clinical scenarios. I believe they are a valuable resource for anybody preparing for any kind of exam in clinics. I wish you all the best.